Let's bring in now Admiral Brett Giroir from the White House Coronavirus Task Force. Admiral Giroir, thanks for joining us again this morning. Are the states now squared away on the number of doses they're going to be getting and when they will arrive?
Yes, thanks for having me on. The states really are squared away. The difference that was talked about by General Perna is there were some initial projections in November. That was even before we had any vaccine authorized, much less two authorized. The specific projections for this week were given on Tuesday of last week, and those are on track. And you had them right. 2 million Pfizer this week, 5.9 million Moderna. They're already on trucks rolling.
I know you hope to have 200 million Moderna doses out by June. Where do things stand when negotiating more doses on the Pfizer vaccine? And when can we expect other vaccine candidates to be authorized?
So we are very confident that by June, anyone in America who wants to have a vaccine will have that opportunity to have a vaccine. As you know, right now we have Moderna and Pfizer. The next vaccine that is coming up, which would be J&J or Janssen, we would expect that authorization to be submitted in January. Again, we don't know the results of that. That has to be unblinded, go through all the processes. It will be very transparent, just like the first two. But we expect that to hit in January. And again, that is a one-dose vaccine. We don't know the results, but we're very hopeful by January we'll have at least 3 vaccines with more to come. And your numbers are right, 20 million vaccine doses distributed at least by the first week in January, approximately another 30 million in January, and another 50 million in February, not counting the J&J vaccine.
That June goal is encouraging and ambitious, but as you know, there's still a lot of skepticism out there about the vaccine across the country, especially in the wake of these scattered allergic reactions we've seen that are being reported. What should people know about that possibility?
So the system is working exactly as planned. Anytime there's any adverse effect, that's immediately reported to the FDA. The CDC investigates. And right now, there are scattered reports. But remember, many of these are tingling and an elevated heart rate. This could be hyperventilation around the vaccine. That does not necessarily mean it's a vaccine problem. We do believe there was one allergic reaction. We know that is an issue with any vaccine, generally at rates of about 1 in 500,000 to 1 in a million. But we're going to watch these absolutely carefully. They're immediately reported, and if there's any change in the recommendations, they will come out. The CDC updated their recommendations last night just to be sure that if you have an allergic reaction to any vaccine, you probably shouldn't take this one. But still, it's widely recommended for everyone because we know it's 95% effective. As much as 100% effective at preventing severe disease. And this is the way we end the pandemic, by getting 70 or 80% of the American people vaccinated.
We saw Vice President Pence and the Surgeon General get the vaccine on Friday. President-elect Biden, Vice President-elect Kamala Harris this week as well. Would it help if President Trump took the vaccine in public?
Well, I think any leader who is influential over groups of individuals should have the vaccine. First of all, I believe everyone at risk or who is very important coming up, obviously the President-elect Biden and Vice President-elect Harris, the President. But yes, I think leadership like the Vice President, the Surgeon General, should get vaccines because they will inspire confidence with the people who believe in them and trust them. And again, we have every reason to believe that these two vaccines are very effective and they are safe. So, I would encourage the president to get a vaccine for his own health and safety and also to generate more confidence among the people who follow him so closely.
As you know, a new version of the virus a new strain of the virus is out of control in Great Britain right now. They're tightening their lockdown very severely, and several countries have now suspended flights from the United Kingdom. Is that something the United States is going to have to do?
I really don't believe we need to do that yet. Viruses mutate. We've seen almost 4,000 different mutations among this virus. There is no indication that the mutation right now that they're talking about is overcoming England. I read the British medical journals this morning. It's up to 20% of cases in one county. Aside from that, it is very low. And we don't know that it's more dangerous. And very importantly, we have not seen a single mutation yet that would make it evade the vaccine. I can't say that won't happen in the future, but right now it looks like the vaccine should cover everything that we see. So I don't think there should be any reason for alarm right now. We continue to watch. That's why we do it. But again, viruses mutate. Over 4,000 mutations that we've seen so far in this virus, and it's still acting essentially like COVID-19, and the vaccines should continue to work very robustly against all of these strains.
You know, the dire warnings of a surge upon a surge of COVID cases after Thanksgiving have unfortunately come to pass. With Christmas coming up, what's the most important thing Americans need to know about the virus right now?
The most important thing that Americans need to know is, although we see the end of the pandemic in sight, and it will end with vaccination widespread in this country, we have a lot of work to do. Really, the lives of tens of thousands of Americans depend on what we do. And you know what to do, George. It's wearing a mask when you're in public, physically distancing, washing your hands. If you're having holiday gatherings, please do them safely. Try to limit them to your immediate household. And if you don't, wear masks inside, improve the ventilation. There's so many ways to do this better. If you look at the Midwest right now in the Northern Plains, they have reversed their very significant outbreak despite the Thanksgiving holidays. Their cases are down, their hospitalizations are down, their deaths are down. That is being counterbalanced now by extreme cases in California, some on the Gulf Coast, including Tennessee in the Deep South and on the East Coast. But we know what to do, and if Americans do these things, we can flatten the curve and save literally tens of thousands of lives if we do these things before we get the vaccine out. When we get the vaccine out, the pandemic is going to end. This is not forever, but we've got a lot of work to do, or it's going to be even a darker winter.
And Giroir, thanks for your message this morning. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.